So what I want to do is I want to understand from you how you use this and what are the um, opportunities for improvement use.
Okay. I guess I would say this. One of the first things I do is kind of a double click on this gray bar and change my default setting that like double click there on that. Or the right
that's
click.
another menu.
Yeah,
I've never done that.
This one.
Okay, cool.
And this Q4 hours, if this just is a default to Q24, I'll show you it's a miraculous change because it weeds out having to scroll these boxes that take so much time from the residents.
Okay.
And so
that could be a good tip of the week.
It really actually could.
And what else?
So hit OK there. That's all you'll have to do.
Okay. Yes, please.
And so, like, for example, if I want to see how many nebs this lady had, I can see exactly what time they were administered. And then when you roll down to the PRN boxes.
Okay, so this is the nebs. And so you're, since I never look at this, you got one at 1 p.m., 1300, 1700, 2100. Is that it?
Yeah, and if you scroll down to the PRNs, it's even becomes a little bit more beneficial because.
Okay.
So you can see.
And is the green the PRNs?
Yeah.
You can tell how many times I've been here.
So it's really nice, I think, for here. If you want to see how many Percocets, okay, they got one at 1400, they got another one at 1800, they got another one at 6 this morning. And if you didn't do this version, you would.
Okay, so there's a column. And why is this column colored?
So
is that the latest?
This is today. Yeah, so this is today.
Oh, okay.
And it usually defaults back about 3 days, which is nice.
And gray is not today.
Gray is, and then these grays are all
okay.
medications, but you can even change this to like active meds or all discontinued. I personally like all of them, so I can see if somebody got like 2 grams of magnesium, for example.
And it got stopped.
It would have been a one-time order.
Yeah,
so,
okay, good.
So as far as tips go, I think having all medications could be a helpful tip for some people to see about, what kind of one-time electrolyte replacements occurred or things prior to transition to our service.
Yeah, okay. So the ones that aren't active, the inactives, are they? How do you see them?
They're gray. They're the ones that are grayed out entirely.
So blue means routine. Gray means inactive.
So there's a good example. Like he got a loading dose of vancomycin, and it was a one-time 2-gram dose, and since then he started on probably a gram or something lower as his maintenance dose. But so if I'm adjusting his kinetics or I need to adjust his trough levels, I can look at this and be like, well, there's a load of 2 grams and then a gram daily to take into consideration with the adjustments. Whereas if you had just active medications, you wouldn't see that unless you looked, or you wouldn't know that, if somebody has acute renal insufficiency, you notice, oh, well, if I didn't have these active medications, I wouldn't have known that he received NSAIDs yesterday.
Yeah. Okay.
So,
and did this hover I notice here, do you ever use that? Do you ever drill into that? Or
no, but what I do is sometimes the ordered info, and I don't know that this is accessible to physicians, but
it is.
Details sometimes will actually have costs listed there, and they're at the very bottom. So it's like if you scroll down there, now you guys may not have them, so you don't have yours. But when I look at it, it says cost of pharmacy, cost of patient.
Wow. Okay.
And so that gives me a little bit of an advantage to see what things are.
Because if it's an oral antibiotic that I think is no big deal, but you know that $50 a dose.
Yeah, I mean literally the Levaquin is $150 versus $50. Go from
you mean IV to oral?
Yeah.
So it's $50 a dose inpatient?
Yeah, like what we charge the patient.
Got it.
So, and obviously they make exceptions and the DRGs come into play.
Yeah. Wow.
But as far as that goes, I only use that maybe if I need to check a rate or things of that nature.
Okay.
Also, this is helpful with the grayed out because we had a lady that just got like 10 boluses in the ER. Yeah. And so those were all entered as one-time liter boluses, so they were all gray. So you could see, wow, she got a liter here.
Okay.
So as far as like more summary, I'd say that's probably, and I like this.
And what's the red mean?
That means it's overdue. So like they were supposed to be, they were supposed to give that and see how his pain score changed, and it hadn't been done yet. Okay. And I also like this in that this column is highlighted, so prior to rounds at 9 a.m. what meds are due at 9 a.m. It's very clear. As in they'll be
how can you tell that?
So this is just the PRN section. Yeah. So if you go back up to the scheduled part, you'll see like this is due at 12:30, and if I was just noticing a low blood sugar, and then I saw a 9 a.m. dose of insulin due, I could say, hey, before and they have the option to give within the first hour. So even though that's due at 9, it's given 8:43 here. This one was given within 30 minutes after.
Got it. Okay.
So it kind of puts in perspective. Do I need to address this right away, or is my dose not due until 3 p.m.?
Finish our rounds and we can
breathe
easy.
For example, warfarin's not due till 1600. So if I want to figure out some details on the appropriate dose, I don't have to do it right now.
Yeah. Okay.
So I think that kind of can be helpful to some degree for people as far as
and the pizza box means it's part of the power plan, and this means it's not part of the power plan.
Correct.
Okay. Got it. Yeah. And then. Okay, so then it turns out this guy came in on that date probably.
Yes.
And doesn't have any meds prior to that. Okay.
Correct.
And so then it'll default to 3 days. You're saying?
Yeah, 3 days is the default.
Okay.
But the backwards, this guy just hasn't been here long enough. But the backward can be feasible.
So then, if you're basically in there, you got 3 days. That's a great starting point. If you only need to go back 2 more days, you just click.
Yeah.
If you need to see like, oh, he's been in here a month,
then I usually do the right click and change the default or change
good.
the dates up here.
Okay.
That's kind of how I use that one.
Okay.
Let's see.
What is this? Show all rate change documentation.
I don't know what that's about. I wonder if that's just about the drip rates. Like if one was at 50 and then it went to 100, if it's an extra documentation.
Navigator. Properties change interval to.
Oh, see, there's a quick change. You could even use that instead of that
instead of the right click.
But I think when people see that, I think they will.
Once you change your
default,
then you're done.
Yeah.
Navigation to.
And once I show this to residents.
Oh, I see. This is like if you want to just jump to a section.
Yeah.
Okay. You had like a ICU, not gigantically long. Change properties. Is that where we did our?
Yeah, that's kind of like the other option. And it's funny because I think I use this MAR summary screen when we talk about patients now, and I rarely am looking at the med list on the sheet because this is so much more precise as far as what time doses are, the PRNs. I can look and it says, Q6 PRN, but that doesn't tell me if they're using it or anything. So I try to.
Here you're seeing what's actually happening.
Yeah, so when we're on the patient at rounds, for example, this is what I tell my students to be on this screen so they know when things are due and what's coming up as far as blood pressure goes. Yeah. And then I'm on this screen as we talk about things because everybody else is looking at their labs and everybody else is looking at all that stuff. Yeah. And I'm just trying to make sure that all the meds are lined up in an appropriately timed basis. And then you also see if, hey, you haven't used this PRN for 4 or 5 days, let's just clean up the med list and DC it. Whereas on the med sheet, it looks like you could be using all those. Well, no one's got a suppository for 3 weeks. Let's just take it off the med list.
So glancing to see they didn't use a PRN is just like it's blank all the way across.
Yeah.
And here somebody had their albuterol, they had a Benadryl at bedtime or whenever it was. Yeah. And they had guaifenesin at bedtime. Okay.
Yeah, and it really just paints a perfect picture of what are they doing with the PRN.
So this oxycodone, to just help me wrap my head around the experience, the little drop, what's that little thing there do?
I think
it just means there's a result comment.
Yes, it just alludes to the fact that they're supposed to enter a pain scale, and it should be the nurse there. So you'll see that for...
Okay, so you got the dose and the pain score that is at what time? Do we know? 1439. Okay, so the pain score is below the associated dose. Okay.
Yep. And for nebs, it includes the heart rate, which is nice as well. So they'll document the heart rate when they administer the albuterol. So
what is this?
And that means that they bypassed this. So like they were going to do something, whether it was going to check a time, but it was too late, he's sleeping, not appropriate.
Okay. So then albuterol, there was a neb in here, right? Is that right? Right.
Yeah.
So would you say there was the...
So then here's got the heart rate of 90.
Got it.
So I think those things are like helpful because if you're trying to see if this is a persistent tachycardia or is it something related to administer.
And so the heart rate is happening prior to the dose?
That is my understanding. They're timed about the same, but...
Yeah, so the question is, does 0239 means that's when we started the neb or that's when we finished, I wonder?
I think it's when it is barcode scanned.
Which would be...
To begin.
When they begin it. Okay, got it.
That's my understanding.
Yeah, okay, that would make sense. Okay, and the little... Apparently this little triangle in the upper right corner is just the... there's a comment.
Yeah, I think it looks like it's just to expand it, and maybe this one because it includes, like, an IV formulation, whereas this one, there's no way, it's just a one tablet. There's nothing to go. And the blood pressure meds also include the BP. So, if you're like making a nice...
If it's a PRN blood pressure medicine. Or is it all blood pressure?
All blood pressure meds. So, like, as far as your pearl goes, you could just make one big pearl that has to deal with all the pearls in just this screen change. You could say, change your screen to this MAR summary that's a Q24. Yeah. And not only do you gain that advantage of efficiency, you gain the advantage of knowing specifically what blood pressures are going with what doses.
Yeah, okay.